Do you have a call recording system? Do you ever listen to it? In this tip, what we're going to teach you to do, I'm going to give you 10 points to grade your receptionist when it comes to new patient phone calls. All right, so great, awesome. Thanks for tuning into this tip of the week. My name is Jeff. I'm the new client services director here at MGE, and we have done over 700 mystery phone calls, new patient mystery phone calls to offices. And I'm going to give you the way I grade these new patient mystery phone calls. So why are we going to talk about grading the receptionist on new patient? Let's start there. The new patient phone call is probably hands down the most important phone call to the practice. And so we want to start grading that phone call first and foremost. There's hundreds, maybe thousands of phone calls that are going to come into the practice over the course of a week or a month. And we want to start with our highest value phone call. Because if we're going to do this phone call poorly, good chance that we're doing the other phone calls poorly. Whether it's an existing patient, whether it's a referral doctor that's calling in, or it's a vendor. Okay, so we're going to focus in, we're going to narrow our view to the new patient phone call. So I hope that you have a phone recording system. You should. There's plenty of systems out there that will do it. You can record every phone call. Maybe you have a call-in dashboard that's associated with every new patient type of marketing that you're doing. But we want to identify those phone calls, and then we're going to start listening to them. What I would do is I would take these 10 points I'm going to give you, and I would just make a worksheet out of it, and I would put it on a Word document. You could split it up into 4. That's what I do. And that way you can listen to multiple phone calls, and there's 4 of them on a sheet. You're going to start to notice a pattern. Ultimately, a pattern emerges when you start listening to phone calls. So either the pattern is throughout the entire practice, you're going to notice that every phone call is the same, and everybody who picks it up does the same mistake, or you can find it localized to a specific staff member, that receptionist. If you have multiple receptionists, definitely listen to all the phone calls, see which receptionist handles it. All right, so let's talk about what I do. So there's a couple things that I listen to almost administratively. When you're listening to a phone call, point number 1, how many times did the phone ring before the phone was picked up? Now, that's a huge point. At my practices, I made sure that phones were picked up by the second ring. So if you're starting to listen and you're noticing the phone's ringing 3, 4, 5 times, there might be an indicator that some of these new patient phone calls have gone to voicemail, or they've been missed entirely, and nobody even bothered to see it. So that's my first point. Is the phone being picked up in a timely manner? Okay, good. Second point, when the phone was picked up, did they say the name of the practice clearly and loudly enough that you could understand what they said? Is it the correct name of the practice? Is the practice Dr. Smith's office, or is it Ivy Dental? How do you want them to say it? This will come back to a point of correction. Do you have a script for that? So if you have a script and they're supposed to say it one way, are they saying it the correct way? Good. Point number 3, did they say their name clearly and loudly enough? I cannot tell you how many times I've made mystery phone calls and the practice name wasn't said, or the practice name was said so quickly I couldn't hear it, and then the name of the person wasn't said. And it's a little bit of a professional point. If you're trying to make a connection with a new patient, it's ideal you know who you're talking to. It always drives me a little bit insane when the office phone is answered, Dr. Smith's office, how can I help you? Well, I mean, how hard is it to say, this is Jeff, how can I help you? It's a bit of making a connection with the patient, so you want to hear those things. And then there's a negative aspect to the phone call as an administrative thing. Was the patient put on hold, and for how long? As a general rule, you typically don't want to put people on hold. Now, I understand that you might have to transfer them to someone who can handle the phone call, and they will be put on hold for a little bit. But the rule of thumb that I had at my practice was, someone will wait on hold as long as my music recorded background on my, on hold messaging will play. For me, well, that was like 2 minutes, and that was stretching it. Honestly, I think you get about 30 seconds. And it's a lot shorter if it's just dead air or a beep. If a new patient calls and they get dead air or a beep, then boom, they're just going to hang up. Okay? So listen for the on hold part. Good. So those are my 4 administrative things that you want to cover when you're listening to the phone call. Now, let's get into the rest of it. Now that the phone has been picked up and we have established that it's a new patient, there are 4 vital pieces of information that must be collected from every new patient. 1, their name. Do not trust the caller ID. I don't know how to say this in any other way. That caller ID, I never trusted it. So don't trust the caller ID for the name or the next piece of information, the phone number. So now we're getting into point 2 once we're through the admin, totally point 6, but we are now looking at name and phone number. Good. Do not trust anything that comes through. You must ask. You want them to ask when you're listening to the phone call. Did they say, can I get your name? Can I get the best number to reach you back on? You're listening for that to be said. Good. Now, the next piece of information that you need to get is, well, how'd you hear about the practice? You know, we're spending a lot of money on marketing. We're doing a lot of advertising. Or maybe we just invested in a whole care to share program and everybody's asking to refer friends and family. You have to ask, how did you hear about us? We want to know what pieces of marketing are working for us. This is a huge part of our budget, maybe every month, maybe every year, and we want to know what's successful and what's not successful. Good. Now, why are you calling is the next piece of information. I want to get interested in the patient. You want to hear that the office is interested in the patient. I can't tell you how many times I've made these mystery phone calls and there's just no interest. They can't wait to get me off the phone. It's like I'm bothering the front desk somehow. I'm asking them too many questions and they can't be bothered to answer them, nor are they interested in getting me in. So you're listening for that interest. You know, when someone calls and says, how much is a crown? Well, why do you think you need a crown? You know, are you in any pain? Is something bothering you? Those are great interest questions. And those questions of establishing some interest in the patient is what's going to set your office apart from everybody else's practice. Everybody else is going through that same, you know, do you have insurance? You know, where do you work? You know, how much money do you make? You know, I've seen practices do that. It's absolutely insane, but it happens. And there's not a lot of interest in the practice. There's more interest in like, how do I just get you on the schedule and shut up? So that point of, well, why are you calling? It's a huge point. You really, I would spend a lot of time on that as personally when I used to answer the phone. You know, I'm ripping through those other things very fast. I'm picking up the phone quickly. I'm saying the name of the practice, my name, very quickly. I'm not trying to put the patient on hold. I'm getting their name, their phone number, how they heard about us very quickly. All of that I can establish and be done in 30 seconds. This part here, why are you calling, is where I would spend the majority of my time. I'm setting myself apart. So you're listening to that. Are they having a real conversation with the patient? Are they interested in them? Are they trying to help them? Good. So you've just established those are 8 points that we've been through, right? And those are huge points. The last 2 points are something that, you know, we should definitely address. One is very black and white, and one is a little bit subjective. The last 2 points I use for the grading will be, well, did they pass or fail the call? And there's only one way to pass a phone call when it comes to a new patient. Did you schedule? Good. So it's yes or no. Now, that being said, you can fail this phone call and do a lot of things right. You can also pass the phone call and do a lot of things wrong. So, you know, we're not just listening for, did you schedule? I mean, that's a great thing, and that's a huge part of it. It's the whole reason we're doing it. But when you set yourself apart by finding out why they're calling and being interested in the patient, it was helping establish that they're actually going to show up. That's point 9. Point 10, lastly, finally, is a tough one, but we're going to talk about it. Were they pleasant on the phone? That's why I say it's subjective. Now, here at MGE, we've done so many new patient mystery phone calls that I know the ones that are unpleasant. And almost one for one, when I have someone listen to a phone call with that receptionist, and I know they're unpleasant, like I wouldn't hire them, they wouldn't be for my practice, I would say it's split 50-50, where half the group goes, no, she's not that bad, And half the group go, no, she's not for us. When you're listening to this phone call, you must remove any type of emotional connection you have with that person. I don't care how much you like them. Are they treating the patient nicely? Are they pleasant? And everybody knows unpleasant when they hear it. Why I say that, this is a huge part, guys. I will take pleasant and mess up that entire sheet every single day of the week over unpleasant and getting it all right. I can't fix unpleasant. It's pretty tough to do, and you don't want that to be the first point of contact for a new patient. If they're treating a new patient like that, how are they treating your referral doctors? How are they treating existing patients? How are they going to treat anybody else who comes into that practice? So you're listening for that pattern. Now, most of the staff are going to be pleasant, okay? But I'm just saying that you have to grade it that way and be real about it and have a discussion with the staff if something seems unpleasant. Maybe they're having a bad day. Maybe they're short-staffed. I don't know. But be real. So those are the 10 points of grading, okay? If you start listening to phone calls, new patients, and I would recommend that you do it often, really, honestly. Go to that dashboard, find the recordings, listen to the phone calls, randomly listen to one or two here or there. I'm telling you, a pattern will emerge on one of those 10 points, something that's not being done well. And that's what's going to allow for correction. These are great people that we hired. I want to invest in them. And the only way to invest in these staff members is through correction. If you never correct them and you just kind of set it and forget it, well, this is what you're going to get. Okay? So listen to those phone calls. Download that sheet at the bottom, the 10 points on how to grade. All of this stuff, guys, we're covering in our new patient workshop. You know, you can find the link below if you'd like to come. It's amazing. It's an awesome workshop where we're teaching you how to create the customer experience, how to create the patient experience from the moment that phone call rings till they're into your recall program. So if you want to check that out, click the link below. Also, if you like what you're seeing, click the subscribe button so you get alerts and notifications. And we look forward to seeing you at our next tip.